Okay, so again, welcome everyone. My name is Kara Kaikini, and I use she, her, hers pronouns. I'm the executive director of the Maine State Breastfeeding Coalition, and I'm really excited to see you all here. Before we officially get started, I'm going to share my screen and have a couple slides here. We're really excited to have Farrah here today to talk about understanding, identifying, and healing traumatic experiences in birth and breastfeeding, a compassionate approach for lactation supporters. And I will officially introduce Farrah in a moment. And just want to confirm. Yes, okay. So here you can access our recording after within a week or so. We like to have, we have a volunteer who so graciously reviews our subtitles and the captions so that they are accurate. But you can always access our recorded webinars on our YouTube page and our Connecting the Dots meetings as well. So that is good to know about. We also have a certificate of attendance. We are not offering CEUs at this time, but we can send you the certificate of attendance if that is helpful. So we'll be sending you an evaluation after the webinar. You can also scan that QR code and that brings you to the evaluation. And if you would like a certificate of attendance, be sure to add your email to the end of that evaluation so that we know to send one to you. And also thank you for signing up. Thank you for making a donation. That is something that we have had to start asking for over these last few webinars. And we still hope that at some point we'll be able to offer these again for free. But for now, we're asking for any donation, as you saw. And we really do get a range of donations and appreciate any of them, each and every one of them. And we also appreciate any kind of donation of time. So these QR codes are on the left. That is a QR code that brings you to our volunteer form if you're interested in volunteering. We have a variety of committees that you could join or different tasks that we could use your help with. So please let us know if you're interested. And the QR code on the right is another opportunity to donate if you're interested in donating more funds, or if you know of anyone in your world who might be interested in donating to a 501c3 small nonprofit that relies on donations to keep operating, then please share that. And again, excited to introduce Yara. Sorry, not Yara, Farrah. I was thinking of another Yara. And Farrah is a perinatal nurse educator, researcher, and consultant whose work focuses on respectful, equitable, and supportive care for all families, birth, trauma recovery and prevention, and care for substance-exposed infants and their families. Farrah offers lactation care and birth trauma recovery support to New Hampshire families as an IBCLC and certified birth story listener with Birth Story Medicine. She provides training and consultation for healthcare teams across the country seeking to improve healthcare quality and health equity throughout the implementation of innovative practices and compassionate communication. I wish Farrah could be everywhere doing this work, and I imagine that those of you who are here would agree with me on that. So definitely reach out to Farrah if you would like her to come to you in your workplace. Farrah co-led the implementation of the Eat, Sleep, Console model of care, an innovative approach to care for opioid-exposed newborns in all 16 New Hampshire birth hospitals, and served as faculty on the National Institute of Health funded study Act Now to train hospital teams across the country in Eat, Sleep, Console implementation. She serves as the secretary of the board for the New Hampshire Breastfeeding Task Force, board member for Postpartum Support International, New Hampshire chapter, and is on New Hampshire's Perinatal Substance Exposure Collaborative. No shortage of experience for Farrah. I'm really glad she's here. She lives in southern New Hampshire with her family, enjoys yoga, exploring the outdoors, travel, and ancestral research. She brings a passion for the use of ancient myths and storytelling to her work with families and professionals. So thank you, Yara, for, sorry, I'm so sorry. Thank you, Farrah, for being here today and spending time talking with us about this really important topic. I'll
You're
turn it over to you.
welcome, Kara. Thank you. And actually, I love that name too. So I'm happy to happy to be called both. Welcome everybody. Just kind of looking at the chat a little bit here too as I'm being introduced so that I can see yeah, what folks are interested in. Not surprisingly, really wanting some resources and to bring some tools back to your own practice. And it sounds like probably your colleagues as well. So one of the things I just want to say as I'm starting out is I believe in information sharing and spreading, and whatever you see here today, like if there's something that you want to use, even if it's an idea that I had that I didn't get from research, like I'm happy for you to take that and spread it and share it. Just always remember to cite where you get things like, hey, I got this when I went to this great webinar. um, but please do share, please do, use the information that you got here today that I've gathered to provide for you to bring to your teams and your work. I also want to say, as I'm starting out, to just we all know that when we're talking about trauma at all, birth trauma and the work that we're doing. Oops. 1 second. Let me make sure I can share here. We just did it a minute ago and it worked beautifully. So let's make sure we can do that again. Oop. So yeah, just a little bit of like making sure that you're taking care of yourself and tending to yourself. So, if that means you need to just step away from the webinar for a little bit, or, whatever that is for you today, please do go ahead and do that. Oops. And for some reason also, I'm not in my first slide. Already being a little wonky. What else do I want to say as we're getting kicked off here? Kara and I were just talking about the importance of really making sure that we are loving ourselves and giving like kudos. We were talking about how it can be a little bit I don't know, uncomfortable sometimes for us to hear, the good things and the good work that we're doing about ourselves. So I just want to name too that, as you are out there doing your work, yeah, be welcoming to yourself, share the good work that you're doing, and also celebrate others. So let's see, all of a sudden my presentation, which was totally good and ready, is wanting to be a little wonky. I use Prezi.
Take your time, Farrah.
Bear with me one
It's
second.
frustrating.
Yeah, I'm like, where the one that I've been working with just wanted to go to sleep for a minute. So let's see. I'm just gonna log back into Prezi. So 1 second. So
Yeah,
if you
I'll
could,
add to
while you're getting started, or while we're getting started, if you could put in the chat, if you haven't already, just one thing that you are really hoping to get out of today's presentation. Here we are. Okay. Yeah, it's like my presentation had just gone to sleep there for a minute, so it needed a little rest like we sometimes do. And share screen again. Let's try that again. All right. Can you see that okay, Kara?
Yes.
Great.
It is showing your
Showing my
not full screen. It's still fine. We're just seeing the
Yeah, let me just make sure that that's the way that I want it to be. Instead of in edit mode, I want it to be in present mode.
Yeah, and as Farah said, like go ahead and introduce yourself in the chat if you haven't already, your name, where you're calling in from, and like she had asked if there's anything in particular that you're looking for today and why it is you signed up. Thank you, Lulu. I see you just added yours.
Yeah. And what are you seeing there, Kara? Just like as I'm bringing this up, anything else besides?
Wanting to hear ways to let clients process trauma in the way they need to, as long as they need to, without interfering with timely, effective early nursing success. And as a COVID delivery parent who has only allowed my partner, who has since left us, in the room at the time, I'm looking forward to this webinar to help me cope with my own traumatic story, since I can't discuss it with the one other person who is present. Yeah, great.
That's really hard.
Mhm. I'm glad you're here.
So glad you're here. Well,
And then from Augusta, Georgia, thanks for being here, Susan. Just love evidence-based skills to support families through their traumas.
oh my gosh. Like Kara, you and I just did this
I
and
know.
shared and it was completely fine. So now it's like keeps wanting to bring me to someplace else. Okay.
There we go.
I got it. Okay. Like
Nice.
I usually say when something like this happens, the little fairies are at play, you know? So
Yeah.
yes, they were with me this afternoon. All right, understanding and healing traumatic experiences in birth and breastfeeding and feeding in general, you know, lactation, just however we're caring for babies um, around all of that. So I do like to just take a moment to think about the land that we're presenting from. So I know that we're virtual, but this is being hosted by Maine. And whenever we're talking about healing any type of trauma, whether that's birth trauma, you know, any other types of traumas in our world, we have to think about the systemic impact on the group of people, the systemic impact of colonization, of systemic racism, of discrimination, all of the things that we know have been really harmful to groups of people. And that includes the people who stewarded the land for so many generations before colonization came, before medicalization of birth came, right? So I just really want to like honor and love on Maine, on the people of Maine and the land of Maine as we begin our exploration today of birth trauma. Also, I'd like to name that pregnant people have a variety of gender identities. And although a lot of the research is really focused on specifically looking at people who identify as moms, we do need more research on the whole spectrum. So my presentation today will use a variety of languages, but just so that you know, a lot of the research, as I'm sure you're aware, has traditionally been focused on mother, so that that will be part of the language today. As we move forward to just like some assumptions that we're going to look at birth trauma as a story and the story of birth and the importance of that from a variety of places and how it impacts trauma and how it impacts healing. So history and culture really impact all of our experiences. So we just want to really hold that as truth, that people deserve to be cared for and safe in birth. And even more than that, that they deserve to have recognition that birth is a rite of passage, right? That it's a sacred event actually, and that it's a great mystery. And we, as much as, you know, we're going to explore what we can change today, what we can impact, we're going to explore the impact of the problems we have within our systems, you know, that cause and contribute to birth trauma. And so we're going to hold that, but we're also going to hold that even with all of the knowledge and all of the information and all the intentions and all of the good work, birth is a mystery, and no healthcare professional or parent can completely control all the outcomes. I like to say that it's really an innately traumatic experience for most people, even when things go really well. So our objectives are, we want to look at the impact of traumatic birth on infant feeding and the parent. We want to be able to name at least, you know, have you leave with one new tool or strategy. I feel like this is probably a webinar of preaching to the choir. I'm sure that the people who came here today, I was looking at the list and amazed at all of the variety of professionals that we have from around the country, and yeah, just all the different work that you're doing. So please like jump in, give us, you know, your take on things, yeah, your resources, maybe how you approach it, your perspective. I want this to be like a collaborative of learning. And I'm just really the guide, the facilitator. And so I'd like you to also to be able to leave with some further resources, which maybe you'll get from me or maybe you'll get from other people on this webinar. So what's your vision or your wish or your dream for birth in our culture? I'd love to see that. I'd love to have you just type that out, name it, say a prayer, write it down in your notebook, whatever it is. But when we collectively like say what we really want to have happen, there's power in that. We know that. So yeah, so share it, name it. And then why are you here? Like, what are you really wishing to hope for? Is it to get some more resources? Is it to know that you're not alone in this work? Is it to have some of your own healing? Whatever it is, I'd love to hear that. So we're going to look at birth today as a story. I think that this is a really valuable perspective to look at birth and birth trauma. So my mentor, Pam England, who wrote Birthing from Within and Ancient Map for Modern Birth, and created a model of birth trauma healing, birth story healing called birth story medicine. And we'll talk about that a little bit more. But she says that as water becomes the shape of a container, we become the shape of our stories and beliefs. And so there is, wisdom there, and that our stories can change, have the possibility to change, and do change over time. And we can expand with that, contract with that, move it around, just like we would with water in a container. So I like to just kind of frame that. Also, Louis Malmadrona, who's another teacher of mine, said that we are a swarm of stories that surround our physical body. So when I use a process called birth story medicine with people who have had difficult or traumatic births, one of the things that I check in on with them at the very end is what they're noticing is different. What they're noticing is different in their thoughts, in their body. And the vast majority of the time, they name a lightening or a lifting or a greater capacity to be able to breathe or more spaciousness, something in there. So the story that they shared and that they reframed or that they were able to have some healing with affected their physical body and their experience, and I would say limited or maybe released or changed some of the suffering they were having. So I think that, the story and birth stories are foundational to all the other healing that has to happen in birth. So what are some truths about stories? And this is just stories in general, not just birth stories. Again, I want to just kind of frame like where we're coming from when we talk about traumatic or difficult births. So stories are old, they're archetypal, meaning that within every story, there are all these different characters. There's the little child in us in birth, there's the naive mother who goes into birth, or the naive parent, believing that if she just trusts her body, everything will be fine. There's the archetypal kind of savior in every story, and sometimes in birth, there's the archetypal hunter, huntress, who's like seeking new information. So stories have all of these archetypes. They're dynamic, they're living, they change. They're not the same story when someone is 24 hours postpartum as they are 24 days, 24 months, 24 years, right? The story changes with time. Story is really essential to our meaning as human beings. When we look back over our lives and we look at our stories and our birth stories, we have an identity attached to that. We believe that we are a particular type of person because of the stories that we've experienced. So it's really important that we look at the birth story and give it some space so that that identity around that story can actually be something that that serves the person going forward. And story is always, it's important to remember that whatever the storyteller believes is truth is truth. And even if we saw it differently, that's our story of it, right? We all have different stories, even from the same birth. Actually, 5 people in the same birth can have different stories. Oh, this was just to mention that trauma is that perspective, right? That we know the definition of trauma is that it's really the person's perspective of what happened to them, that that means that they had trauma. It's not something that somebody gives to them. It's not something that I name like, oh, you had trauma. If I feel that I had an experience of trauma, then I had an experience of trauma. PTSD, post-traumatic stress disorder, is obviously a diagnosis. And so that's a little bit different. And there is a percentage of people who've experienced difficult or traumatic births that actually do have PTSD. But as we'll see from the research, and you probably know that, it's really common to actually just have the experience of trauma, of like feeling like, oh, we got somebody in the waiting room there, I'll admit. Just the experience that somebody has had trauma is their own, and they get to decide. That is the main point there. So then we have the historical story. And so I put this together, I don't know, about a year or so ago, when I was really wanting to be able to picture like birth in our culture, birth in the United States over the last really, couple of centuries or longer, and just kind of like the trajectory of that. How did we get to where we are today with having so many people feel like they're experiencing traumatic births? So a couple of the big takeaways, there's a lot to look at here, but if you look at midwife attended births, we can see that there's been a really significant change there. In around the turn of the century, it was 50%. Obviously, in the late 1800s, it was even greater than that. And that's not to say that when it wasn't a midwife attended birth, it was in the hospital, because still a lot of medical doctor, obstetrician, which was a new field, attended births were still actually happening in the home, around 1900. And then as you get further in that century, pretty much we were down to, practically non-existent, right, in around 1980 of midwife attended births. And then there was a certified nurse midwifery really started to take root, and we started to see, an increase again. And now, in some states, depending on what's going on with lay or professional midwifery as well. So we're seeing an uptick on that. And then with births in the home, we have, there was obviously a huge decline with that. And so we want to look at birth trauma, not just in the individual lens, but also as a collective. And so what has been happening in our culture in order to contribute to the rise in maternal mortality, the discontent with birth experience, right? Because at the very least, many people are not feeling good about their birth experiences, and then also the rise in trauma. And I propose, and I don't think I'm alone in this, that one of the reasons for that is because over time, birth was taken out of the community, out of the safety of the home, out of the circle of women and birth professionals and people that were traditionally trained to tend to birth. And it was put into a place where people were very isolated. So even if we just look at that, with anything, we're going to see more trauma when people are taken away from their safe place and put into a place where they're more isolated. And that's not to say that good things didn't also happen, but one of the results of that is that people can experience a more traumatic experience when things are difficult. Also, the seeds of birth trauma culturally are, I believe, one of the foundations of that is that the maternal mortality rates, there's more awareness about it. There's higher rates than really there should be. Even in the turn of the century, 1900, we saw that the US was slightly higher in maternal mortality than Europe. And this is when, again, 1900 is when still, most births are happening at home. Most births are happening with midwives. Around 1920, of course, we do have the end of the Spanish flu. So probably a lot of deaths are going to be related to that. But it's also really when births were starting to be much more medicalized, taken out of the community and away from midwifery care. So we saw a huge uptick in maternal mortality during that time. Obviously, gradually, it's been, we've gotten a lot better, but it's still, as all of you, I'm sure on this call know, not acceptable in comparison to the rest of the world and really where we should be. this was just an interesting piece that there was a difference between midwife attended and physician attended births. This was specifically in Philadelphia. So again, just to show, this isn't like a blame game on obstetrics, but that there is sort of almost like, I believe in ourselves, some sort of fear and trauma that already exists for us at this time and place before the individuals even going into birth. We have this kind of collective experience over the last, say, 100, 150 years in our culture. So that's the historical story. So I just want to pause there and see if there's any questions or comments or thoughts about that, or anything that anybody has to add before we move on to the personal story. And I haven't been able to really see the chat. Twilight sleep. Yeah, good point. Exactly. Twilight sleep. My mother, her first child was born in 1970 and she was put to sleep. And I was born in 75 and she learned Lamaze. And so those two births were so different for her. She was very empowered by the experience of mine and very disconnected with my sister. Methods of delivery are contributing. Cesarean birth rates, yes. I mean, we could spend 2 hours just on the history and how that's impacted birth trauma, right? So hopefully you guys are able to read through. Anything, Kara, that I should know that's a question in the chat that I should pick up right now?
No, nothing that's popped out.
Great.
I had a question.
Yeah.
It's Joyce. I just wanted to know if you could provide the source for the data for that maternal mortality in 1920, just when you get a chance, no rush.
Yeah, I have it. And actually, I'm going to send all that as a
Okay.
PDF to Kara
Cool.
to send out after.
Thanks.
So, so then we're going to look at the birth person's story themselves. So I just read a book, for those of you in Maine, have you seen this book or heard of it? The Frozen River by Ariel Lahan. It's about a midwife who actually existed, Martha Ballard, who did not lose any mothers in birth for the whole course of her career. It's a beautiful book, and it's actually like a mystery. It's really like it takes her life and kind of builds a novel around it, but it's a beautiful book. And this is one of the quotes from it, and I just was blown away by this quote. I was like, yes, like all mothers, I have long since mastered the art of nurturing joy at one breast and grief at the other. And I just thought, wow, talking about infant feeding today and trauma like this pretty much captures the experience of motherhood. So, the birth person's story, I think one of the things that we can do, if nothing else, is to name that mothering holds really all emotional and spiritual and psychological experiences to the greatest intensity that you've ever experienced them before in your life. And birth is not unlike that. And one of the things we can do to really mitigate trauma is to name that and be honest and truthful about it, that it's not just going to be all joy. It's not just going to be, euphoric. It's also going to be hard. And we can feel sometimes like, all kinds of scary things. So I'm not going to spend too much time on this, because I know that, again, a lot of you know it, but, we have, again, higher rates of maternal mortality than we should, especially around, with disparities for Black and Indigenous and people of color. And then we have what we know about birth trauma is, depending on the study that you look at, really it's 1 in 3 to a half of people who are birthing. And again, most of this research is on mothers specifically. And so we don't have a lot on people who identify in other ways, but that they self-report that they feel traumatized by their birth. When we look at PTSD specifically, obviously that's a smaller percentage. And then we have OB mistreatment, which 1 in 5 to 1 in 6, depending on what you're looking at for some research. We also just want to name too that, like, being in a hospital environment in general can be traumatizing for people, right? So never mind the birth, but just like the hospital experience, the rates of NICU stays, that all increases it. Obstetric mistreatment is a part of this as well, because it's going to contribute to a person's experience of birth trauma or prenatal or postpartum. Birth trauma isn't just in birth. It can be really any time in that perinatal time. And so this particular study did show that, 1 in 6 women are experiencing that it's an up and coming and emerging field. And, we don't have a lot of information or even definitions around it. This slide is really just to show that, there's an increased risk of trauma for when people are experiencing disparities. And then with feeding. So what do we know with feeding? So I'm going to share a resource of a woman that I've been following who is doing some research in this field, and this comes from her. But she found that in her survey that 83% of mothers experienced moderate stress over their baby's first year feeding choices. That's really high. And that 61%, this is, I think, even more alarming, of a percentage of mothers are feeling some shame or anxiety or kind of self-blame or doubt around their feeding choices. And so this is contributing to the experience of trauma and feeding. And why is that? Like what is it that we're doing in our culture that's contributing to that? So this is the part that I think is probably going to be a bit new. When we look at research, we can see that there's a lot of different contributing factors to birth trauma. Some of what I just shared, right? We have the historical context of it. We have fear around maternal mortality. We have disparities. But my mentor, Pam England, this hasn't been published, but this is kind of her observation, her findings, and how she developed, why she developed birth story medicine, is that she's really seeing that the seeds of birth trauma come from a variety of places, not just history, not just medicine, not just healthcare, but even from our first birth story, from the belief that we have going into birth. And how does that end up aligning with how we actually experience birth? So if my first birth story, for example, was that maybe my mother had another child and I was a little bit older and I got to see part of that, and everything went really well and it was beautiful. And everyone in my family has vaginal births, and, people who birth in my family tend to, do really well. And maybe there's even a story in my family about just trust your body and everything will be fine. And I show up at my birth and my baby's, breech, or I have hypertension, or, something else is going on where I need some intervention and I'm not able to birth in the way that my family birthed. That could be a seed of trauma because the expectation that I had about birth was greatly different than what actually happened in birth. And the beliefs I held around who I was supposed to be in birth were so different than what had actually happened that I'm going to end up in some type of really a crisis, right, of identity around that. And so that can be a seed of trauma. And so you'll see that, there's other seeds here that traditionally we're not looking at in research or we're not looking at in healthcare, but really when we look a little deeper, we can see that there's these other factors. And oftentimes there's multiple, right? There might be a combination of a first birth story with a physically overwhelming experience, with not having somebody to really process with, and you combine all that and you end up with the experience of having a traumatic birth. We can also look at, sometimes we think, or other people who maybe aren't in the field believe that it's just a result of the medical thing that happened in birth. But really the thing that tips the scale that we find is that it's how the person perceives the event, right? They felt abandoned, they were shocked, they were surprised. And it's not just that there was an unplanned cesarean, but, really it has to do with the relationship piece. This would be the relationship seed. And so what do we see actually? What's presented from the person who's experiencing trauma is, if you listen to the story, eventually what comes through is these like identity statements. I am a failure. I am alone. I should have known. I should have spoken up. The mama today, actually, that I worked with this morning said, I felt like I was being a burden. That was her core sort of wound that she's actually been carrying from the time she was a little girl, and it showed up in her birth. So we often notice too with birth trauma, if we listen really deeply, that what comes for a person was seeded a long, long time ago, and it's not the first time, their birth is not the first time that identity is showing up. And then there's the patient power, dynamic. Kara, can you just give me a time check and let me know what time it is?
Yes, it's 12:37, so I would say another 15 minutes or so before some questions.
Awesome. So power dynamic, we have also, so I'm just going to actually pause here and let you guys read through this, the impact of difficult or traumatic births that we find, and let me know what you notice with that. So what's something that either stands out to you or is surprising or that you know, are noticing? You can chat or unmute. Any thoughts? I think the big thing that I want to point out is that we often think that difficult or traumatic births have all negative consequences, but oftentimes there are some really positive things that can come from the experience, especially um, you know, when the person actually has someone to really listen deeply to their story and help them to like process and heal the experience. Yeah, we don't often think about the positives, whether that's spiritual or otherwise. A lot of times it's, the first time that somebody realizes, wow, I like this mama that I worked with today, she's kind of unburdening herself from feeling like she's a burden. Um, I'm actually going to skip that for today. We want to think about the triggers of a trauma response in general. And so when we're thinking about birth trauma, most of the time we're in hospital settings, and literally like all of these things are things that are happening for a person who's in a hospital setting, even if they're there for a really chosen and, important and sometimes wonderful experience of birth, they are still experiencing all of these things. And that can be triggering and cause, some level of trauma response as well. And then we want to remember that people who are experiencing a lot of stress, which birth is, can be in the state of being a little bit more simplistic or hyper focused. Also, you kind of have like I call it labor land, right, where we're not, our frontal lobe is not the thing that is highly active in labor land, especially in an unmedicated birth, but really in any birth. Um, it's our primal brain that's like firing. And so we don't have access to the same resources. And when we're in a highly medicalized, stressful environment, we can sometimes look back and say, well, why didn't I ask that question? Or why didn't I advocate for myself? So it's really important to validate to people who are giving birth that because your brain actually isn't working the same way as it is now, looking back and processing. And so a lot of people criticize themselves for that, and that can be the seed of trauma as well. So this is what the goal is, right? Is to get to the other side of that, to feel lighter, to feel stronger, to know that they're good enough, to know that they're connected and loved. And even if somebody had a really difficult or traumatic birth, they can get here. It's possible. And our deep listening and loving to them can help them do that. And also we want to prevent, really as much traumatic birth as we can, right? But innately, people will still have difficult experiences. And so how can we help them?
Farrah, we do have a question that came up from Robin asking, how is positive praise traumatic? Do you mean
Oh,
something like gaslighting?
yeah, or it's more if yes, it can be that, but also if a person had an experience in their childhood where praise was used to coerce them or to get them to do something they didn't want to do, then praise can sometimes feel threatening to people. And so that's especially true for people who've had other traumatic experiences, sexual abuse, substance use, violent or aggressive relationships. Does that make sense? To answer the question. So that can sometimes happen. When it comes to our own difficulty, we know that people working in healthcare have high levels of stress, especially in birth. I'm not going to read through this, but essentially it's that technology affects our ability to be compassionate. It can make us come across as not that compassionate, and it can take us away from ourselves actually and being able to really connect. We know that we're experiencing secondary trauma, right? And that has a ripple effect into our patients and the people that we're caring for. So all of these things are affecting us. Again, we could spend an hour just on this piece, but I want to name that birth trauma, part of the soup that we're swimming in, is also what the birth professional is bringing to it. And we have to have self-awareness in order to help other people to prevent trauma and to heal trauma. We have to do our own work. It's like one of the most essential things. So these are just some questions that I like to kind of just put out there, what's our role? Like, is it our job to be aware, to prevent, to know ourselves? How do we go about doing all this? This is kind of, all the things we're talking about today, but I like to kind of just name those. So most importantly, how do we transform? How do we make a difference here? So I like to say, like, being self-reflective is like that oxygen mask, metaphor. We have to first do that. We have to believe that patients are autonomous and can make their own choices, even if that means it doesn't align with research or science or best practice or our recommendations. It doesn't matter. They get to decide that for themselves as autonomous human beings. And it's really important that we recognize that our our governing bodies actually have writings about this in bioethics, like we're supposed to do this, but as a collective in healthcare, we do not practice this. We're very paternal in our system. And so, if you see that in yourself or in others, like, name it and just say, hey, I think we're not really honoring this. This is one of the PDFs I'm going to send you guys, just a really great acronym on decision making and supporting families, I think, to really help prevent birth trauma, but it's a really good tool. Screen. I'm not going to go into all the screenings today, but this is a really great resource, saferbirth.org. And hopefully many of you in whatever states you're in, you guys are implementing the AIM safety bundles, but screenings are a really important way to, oh, actually, I do want to say one quick thing about that. And that is for birth trauma. We don't actually have to use some type of standardized screening tool. If we just ask this question at prenatal visits, when somebody is admitted to the hospital in labor, when you're doing that home visit, do you have any history of trauma or difficult births that might impact this birth experience or that you're worried about? Like, just asking that can be a game changer. It can really open someone up to say, oh, this is a safe place for me to share, this and what I'm worried about. Because I guarantee the majority of people who are birthing have something in their past that they're worried about, whether it's their own past birth or, something in their life. Communicate with compassion. So checking in with yourself, what are the ways you can do that? This is a really good resource. Hopefully most of you have this, but SAMHSA's 6 key principles of trauma-informed care. And also, this is the birthing from within model of childbirth education and preparation. And so I essentially use this in all of my interactions with families, with individuals, before I ever educate them about anything or collect information from them or do a screening or anything. I first always start with just validating what's already going on for them and being curious about that. Naming, the variety of experiences they could be having, naming how difficult their birth was and really like honoring what they just went through. And then finding out for them, like, what are they really wishing for? What's their motivation? And then moving through all of these pieces. And what time is it, Kara?
It is 12:46.
So practice tips, touch and communication are key when we are wanting to really prevent and heal birth trauma. So lots of communication, lots of permission, hopefully. I mean, I think that you guys know that part, but I think really, just reminding us of that and how important that is. And really remembering, I didn't go through the slide with the green zone, but essentially trying to help people really stay in that neutral state. And it's normal in birth to, feel scared and anxious. So normalizing that and trying to help people kind of come back down to that place of feeling really safe and held and heard and accepted and loved. Sometimes we have a hard time being compassionate. We might notice the judge being like, why is that mom doing that? Or why is that healthcare provider doing that? Or I don't understand why they keep making that choice and shooting themselves in the foot. So if you're having a hard time with the compassion piece, just be curious about it, ask some questions, and that can kind of shift the judgment and hopefully prevent some of the seeds of trauma that might be inadvertently coming. Take care of yourself, make sure that you know that you're not alone and reach out for support. That's a way to transform people's birth stories. Um, and even especially when it comes to feeding, when it comes to lactation, like if you're not sure what's going on, reach out and get some help. If you're not the expert in a particular area, right? Like get your helpers. Um, and then finally, just, knowing that when people are sharing stories, they're moving through all these different gates. They're moving through all this also comes from Pam English. They're moving through not just one story, but social stories and medical stories. Sometimes they're sharing the timeline of their story. Sometimes they're sharing the meaning of their story. And we can help them to do that when it comes to, if it was like with feeding with their infant, what's really going on by being curious and listening to like, are they hunting for something new here? Are they wanting, are they, really in that story of like the medical story of what happened with their infant feeding and all the weight checks they had to do, like which story are they in and how can we kind of meet them there, and some suggestions on how to really listen to birth and feeding stories, validate, 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 tell the truth, tell the truth, tell the truth, like don't Pollyanna-ish anything in birth or feeding. um, Help people get their support, believe and honor that it's a significant rite of passage and that the struggle is normal. And really, like I said before, accept, that they're autonomous human beings. Birth story medicine is one great resource, and that will be on the resource list. That's one of the strategies that I use, tools that I use. And finally, really speak up. So if you're seeing something in a mama that you really, or in a parent that you really want to name, like how amazing she's doing with skin to skin, even if the feeding isn't, going as well as she would like it to, name it, and if you're seeing a healthcare professional do something that you feel like is like, ugh, that is hurtful, name it. Ultimately, when we do all that, we want to get to this place of like, yeah, birthing people feeling stronger, feeling loved, feeling capable. So I want to take some time to just open it up for questions and yeah, comments, and or if there's like a particular thing that folks are, sorry, it feels like a little zippity zip because my beginning was so delayed.
Okay, thank you, Farrah. This has been
Yeah.
really interesting. And a couple questions about the handout. So you will be sending some resources. Is that, can you say a little bit more about what you'll be sharing with us?
Yeah, the BRAIN acronym is like a PDF. It's a 2-page, so it really helps you go through like all of that, which is so helpful for infant feeding as well. It's like helping families to make decisions and kind of reflect back. And then these resources will be on there as well, that are here, and then the references from the studies that I cited.
Thank you. And could you put your email address in the chat box?
Yeah,
To access that?
right here.
Okay.
It'll be on there, but yes, I can put it in the
Okay.
chat now as well.
And Paula had a comment. Paula, if you want to unmute and ask, go for it. I can also read through it, but I want to give you the chance to share it on your own first.
Hi. Sorry, I was eating. I've been doing support groups for about 28 years, and I also do prenatal education. And a common theme that I'm seeing popping up, maybe even more often, is families who had planned home births and end up having a hospital birth, and very often a cesarean, and they feel like they have no community anymore.
Mm,
And like they don't belong in the home birth community. They weren't planning a hospital birth. And so I'm curious if you have any thoughts on what prenatal educators can do to sort of, preemptively kind of help them understand that I feel like the transfer rate is probably around 30%. That's my sort of guess. Um, to sort of help them understand that that's a possibility without, there's a lot of thought, like there's a lot of people presenting like positive thoughts, like only, and that frustrates me as someone who has attended a lot of births, many home births ended up in the hospital. How do we prevent like making the trauma worse for these families before they even have their babies?
Yeah, I think being honest with what you just said to them, like, oh, what we notice is about 30% of people transfer. And we find that when moms and families and birthing people are prepared for that and know that that could be one of the options, then the difficulty on the other side will be mitigated. We're going to do everything we can to prevent that from happening. And also, just like you would, like, I often use the metaphor of, you know, if you are traveling to another country, right? Like you're going to wish so much that the weather's awesome and that you're not going to, whatever, run into complications, but you're still going to prepare for the things that you don't want to have happen. If I go to Ireland, like I don't want it to rain, but I'm going to bring my raincoat. Maybe that's not a great example because it's going to rain in Ireland, but like you're going to bring the things. If you're traveling with your baby, you're hoping that they don't get sick, but you're still going to bring some ibuprofen just in case, like you're not going to not prepare yourself for the things that might happen. And so in birth, for some reason in our culture, we have this like spiritual bypassing of if we just manifest the best thing, then it will happen. We can't apply that to literally anything else. So I just speak the truth, say exactly what you just said. I'm going to be by your side. I'm going to do everything I can to prevent that transfer because I know that's what you don't want to have happen. And then I think the second piece of that, and this is such a great question, Paula, thanks for bringing it up, is ask them, what is it that you are avoiding or that you're hoping won't happen as a result of that? Like if that transfer were to happen, what's the scariest thing about that for you, actually? Because sometimes we think it's the transfer, it's the cesarean birth, it's the hospital. But what it is I'm afraid that I won't be the mother I thought I was going to be. That's actually what it is. And so when we're preparing people for birth and infant feeding, we want to identify what the thing they're most afraid of and help them prepare to overcome that in addition to preparing for the thing that they really want. And so that's what I think is missing in childbirth education is preparing for the fear. We call it the tiger in birthing from within. And actually what we do is we walk them through the tiger process. What are you the most afraid of? Let's see that all the way through and see you being so resourced that you can cope with that no matter what happens. That's not manifesting it into existence. That's practicing being an adult, that's what we have to
Yeah,
do.
fear is such a huge part of birth experiences, seems like, and the resulting feelings around it. Lulu just mentioned that she addresses the potential for transfer when working out the birth preferences worksheet with clients, figuring out the preferences in both scenarios of the opportunity to feel empowered in decision making in either case up front. I think that's great.
Love that. And a lot of times you can identify exactly what that is, right? Like, what's the most important thing to you? Okay, it's bonding with my baby. So if you can't be skin to skin, can you sing a song? Can you sing happy birthday? Can you, what can you do to really make sure that you're getting the thing that you want the most, even if the way that you think it's supposed to happen doesn't happen?
Yeah, I think it's so great to talk through the expectations. Like what do you think is going to happen and how does that connect to your identity? I think the identity piece is so huge. And I really appreciate that that's been brought up. And so that if the expectation doesn't get matched, then that, how do people interpret that? And it kind of goes to Joyce's question, which is, do you have any indicators for prediction of reported experience of birth trauma? Any particular mental health diagnosis prior to delivery? It's interesting that the exact same situation can occur. And to some people, it's traumatic, and to others, no issue. And I wonder if it is some of that expectation. Some people might like, well, yeah, birth is supposed to be horrific, and that's what happened. And so, it still could
Exactly.
be traumatic, but maybe not as much as for someone who really expected it to be
That's right.
experience.
Yeah, Joyce, I mean, first of all, anyone with a previous mental health diagnosis, whether that's anxiety, depression, PTSD, whatever, has a higher risk of experiencing birth trauma than, than not. And then also anyone who already is coming in with inequities, discrimination, stigmatization, whatever. So there's that piece. And I don't think there's been any research done in the connection between kind of that negative I am belief and looking back to early life and seeing if there's a thread. But I can tell you in the birth story medicine sessions, which is, I don't know, I've been doing it for 10 years, so hundreds now, it's always the case. I mean, I've never had a person present in a birth story medicine session where that negative self-belief is the first time that that's shown up. They can always trace it back 3 years old, 8 years old, 14 years old. Those seem to be key ages for when these things like come.
I always
Yeah.
look at everything from like the perspective, like, well, if we have this information about this as a nurse, right, as a patient, so we know that, they have this diagnosis, and then we kind of, use that moving forward to kind of hopefully offset any
Yes.
potential things. That's why I was kind of asking for like something specific. I have a friend who had very traumatic birth experiences, and they were just kind of quick, but everything was great, but still struggled with that. And she had this huge anxiety diagnosis and really struggled with that. I had 3 C-sections and was like, okay, whatever. I don't see my kid for 24 hours, whatever it is. And I was like, okay, that's what it is. Yeah. Am I a little sad about it? But it wasn't trauma to me. So,
Exactly.
I mean, there's a lot of things and a lot of expectations too.
Yeah. It just speaks to the individual soup that you're swimming in, the culture, the family conditioning, the individual, makeup, personality, all that. Yep.
Yeah, and expectations around skin to skin, as Robin is mentioning, Robin and Paula in the NICU, that when people don't get that experience, that can be really, for so many reasons, that can be really upsetting. And breastfeeding, right? If that's what their hopes were and their expectations and their plans, and they put everything into that, their expectations, but also cultural expectations around that certainly can be very difficult.
That again, infant feeding and trauma is a up and coming field as well, right? So we know that it's there. If there's a mismatch of expectations, there's a higher rate of trauma. And again, how to prevent it is a lot of anticipatory guidance around. Oftentimes feeding doesn't go the way we thought it was going to go. It'll look different than what you think. So what is it that you're the most worried about, so we can help you prepare for that,
Joyce made me think of something that I have seen pop up too, is um, the language that we as, providers use around them, but like things like I've seen families traumatized because they wanted an epidural and they didn't get one. And the language coming at them is like, oh, but you did it and you like had a great birth. And it seems to kind of make the trauma a little bit worse. Like, trauma doesn't have to be that birth went horrifically wrong. It can be as simple as like I had planned for an epidural and I walked in that door too late and didn't get one.
Absolutely. Yep. It can be giving a baby one bottle. It can be something that we think is like not a big deal at all. And what you just described, Paula, too, is like when when as healthcare providers, we just kind of gaslight them and we're like, oh, but it's fine, it's no big deal. The little story that I often use is when we're kids and we fell off our bike, what did our parents say? They were like, get up, you're fine, you're not bleeding. Da, da, da. What were we actually experiencing? We were experiencing pain, fear, embarrassment, right? And in our culture, we are just not good at. We haven't learned how to actually name the thing that's actually happening. And so as healthcare professionals, we didn't learn how to do that in our homes, and we didn't learn how to do that in school. And so we have to, figure out ways to do that. So I'll send you guys that model that I use too, the birthing from within model, because it starts with validation. So like literally every interaction starts with validation. And that's one way that you can really mitigate, worsening the trauma, Paula, right? Yep. So I know we're at time, Kara, and as always, it always feels like so much more we could talk about, but I hope I gave people a few good new nuggets today, and I'll send out the references and a few resources. And I would love, like, if people just want to chat and have conversation, about this. We need more research. I'd love to, if anybody is doing research, I'd love to participate. So please, shoot me an email, give me a call. I'm pretty easy to find. I'm the only Farrah Sheehan. So if you Google me, you'll find me. And this was so good. I'm so impressed by all the people that are here. And I wish that I could just like stay on and learn from all of you, because I know you all are experts in the field, and hope that I guided us today just to, kind of keep expanding our awareness. Thank you so
Thank
much.
you so much, Farrah. Yeah, it's been great to see the nuggets of wisdom shared in the chat too. I know that everyone here this is an important topic to you. So thank you for doing the work that you all do. And thank you for being here, Farrah. And hope to see everyone soon.
Do you save this chat, Kara?
Yes.
Great. Okay, awesome. Thanks, everybody. Have a great day.